Hey everyone, welcome. Today, we're going to crack open the CPT codebook to really master a concept that can trip you up when you're starting out. So let's jump right in.
Sounds a little wild, doesn't it? But nope, this isn't a riddle. It's a core concept in medical coding called bundling. And let me tell you, understanding it is absolutely key to being accurate. Today, we're going to see exactly how this works with a very specific set of procedures. Okay, first things first, let's get our bearings in the CPT manual. We're heading straight for the urinary system section. Think of this as the neighborhood we're going to be exploring for the next few minutes.
And now that we're in the right neighborhood, we're going to zoom in even more. We're not looking at everything. We're zeroing in on a specific category: therapeutic percutaneous procedures. And all that means is procedures that are done through the skin to treat a problem.
This is it. This is our target for today. I really want you to lock this phrase in your mind. Therapeutic percutaneous ureteral stent placements. It's a mouthful, I know, but this is precisely what we're going to decode together.
And here they are, the stars of our show today: 5693, 5694, and 5695. Get familiar with these numbers, because we're about to dive deep into what makes each one so unique.
Okay, I want you to think of these codes, especially those first two, like a package deal. You know, like a combo meal. You don't code for every single little thing the doctor does. Instead, CPT bundles a whole bunch of services into one big code. Why? Because they're all considered essential parts of the main procedure. This is exactly where new coders can get tripped up if they're not paying close attention.
This right here is the million-dollar question for any coder. When you're reading that physician's report, you have to know what's already included in the code you're about to pick. So, you ready? Let's pop the hood and see what's inside.
So take a look, this is the whole shebang. When a physician performs a stent placement using code 50693 or 50694, all of these services are already baked right in. We're talking about getting access to the kidney, any little catheter wiggling they have to do, the diagnostic pictures they take, the imaging guidance to see where they're going, and the supervision of the whole thing. The biggest takeaway here? You cannot, I repeat, cannot bill for any of these services separately. It's all part of the deal.
All right, so you're feeling good about the basic package deal, right? Awesome. Now let's level up. We're going to look at a more complex situation. This is where our third code, 5695, comes into play, and you've got to know its very specific rules.
So here's the scenario. Imagine the doctor goes in, but they don't just place a ureteral stent. In the very same procedure, through the same little hole in the skin, they also place a totally separate device, a drainage catheter. So, how in the world do you code for two devices?
Before we get ahead of ourselves, let's make sure we're all on the same page. That separate drainage catheter has a name. It's a nephrostomy catheter. So, what is it? It's just a tube that goes straight from the skin on the back into the kidney so urine can drain out. So you have a stent draining inside and this catheter draining outside. Now, CPT is super helpful here. It gives us a very clear, very specific checklist for this 2-for-1 deal. To use this special code, you have to be able to check off every single one of these boxes in the doctor's report. It's got to be both devices in the same spot at the same time through a brand new access point. There are no exceptions.
And if you can tick every single one of those boxes, bam, you report this one single code, 50695. It's actually brilliant. It covers the placement of both the ureteral stent and the nephrostomy catheter, plus all 6 of those bundled services we talked about. It really is the ultimate package deal.
So let's boil this all down. Let's get to the core principle that you absolutely need to walk away with. Seriously, this is what's going to set you apart. This slide just lays it all out so perfectly. Look at the left side. For 5693 or 5694, you're coding for one device, the stent, and all its bundled goodies. But on the right side, for 5695, you're coding for 2 distinct devices placed in the same session, along with all those same bundled services. It's really about just counting the final number of devices that were placed.
And honestly, this is the most important thing I want you to remember today. If you take away just one thing, please let it be this. As a coder, you're not just a code finder. You are a translator of medical procedures. Your job is to truly understand the anatomy of the code itself. So, I'm going to leave you with a little homework, a question to chew on. What is the #1 reason a coder might accidentally try to bill for, say, imaging guidance separately, when we know it was already part of the package? Really thinking about that is going to make you a much sharper, more accurate coder. Thanks for joining me for this explainer, and keep on cracking those codes.